talking about the cardiovascular system, particularly endocarditis. First of all, we're going to talk about the haystack organisms that do not grow on blood cultures, and we're going to be talking about non-bacterial thrombotic endocarditis as well as Liebman-Sachs endocarditis. So the haystack organisms, acronym Haemophilus, Actinobacillus, Cardiobacterium, Elkanella, and Kingella. Present with fever, murmur, Janeway lesions, osseous nodes, and anemia of chronic disease. Essentially what's happening with these Janeway lesions, osseous nodes, and anemia of chronic disease is that you end up with septic emboli. So, in other words, some blood, there's some thrombosis that occurred and some blood clotted together, and then it broke loose and it floated throughout the body, and it created these little tiny moving thrombus, an embolus. But you get lots of them. It's septic. It's everywhere. It's all over your body. So there's lots of these septic emboli. And when these septic emboli go into your hands or whatever, they get stuck in the little tiny capillaries and stuff in your hands, and it creates these little these little Janeway lesions. And the Janeway lesions are painless. However, an osseous node is ones that happen like in your fingers and stuff, and those are painful. What you can think of is O for ouch. Osseous nodes are painful. And then also, because all of your clotting factors are being used up in these tiny septic emboli from these different bacteria, you end up using them all up, which causes anemia. So you end up with a microcytic anemia, typically, anemia of chronic disease. And I guess this positive blood culture, that seems to contradict what we said earlier. And then lastly, we have the transesophageal echo, sometimes called the T, and those are helpful in detecting the lesions. So over here we have the non-bacterial thrombotic endocarditis. So these are essentially, this is the case of a thrombotic endocarditis. It has nothing to do with bacteria. So the sterile vegetations, they arise with hypercoagulable state or underlying adenocarcinoma. So it's kind of cancer, or sometimes you can be in a hypercoagulable state, your blood clots really easily. And if this happens, then you would get non-bacterial thrombotic endocarditis. Vegetations arise on mitral valve along the lines of closure. So here's your mitral valve or whatever. And where it closes here, it'll happen on these spots here. And the result is regurgitation. So apparently it'll mess it all up so the valve can't close. I guess I drew the wrong valve there, but it closes so that the blood comes back, regurgitates. Now coming over here, talking about Liebman-Sachs endocarditis. These are sterile vegetations with systemic lupus erythematosus. And this, one of the ways you can tell is that these vegetations will happen on both sides of the mitral valve. So here's the mitral valve. It'll happen here and it'll happen here. If you remember the mitral valve, if you've got the heart, right atrium, right ventricle, left ventricle. This is the tricuspid valve. This is the pulmonary valve. This is the mitral valve. And this is the aortic valve. So the mitral valve is right there. So that's where these are going to occur. And this results in mitral regurgitation, and that's it.